Hi, my name's Justin, and I'm here with Liam, and we're going to be doing a skin assessment, okay? All right, buddy. Okay, so if Liam were an adult, or if his mother was here, which I'm his dad, so this is okay. But if his mother was here, I would ask him if, or her, I would ask if there's been any changes in Liam's skin pigmentation or color. I would ask if he's experienced any excessive itching or uh, any dryness or excessive sweating. Um, I would ask if there's been any bruising or if there's any bruises that he's concerned about. I would ask about any rashes or lesions. I would ask about any changes in his body hair distribution or hair loss. Um, I would ask if there's been any changes in his exposure to chemicals in the workplace or at home. I would ask about his sun care routine, what his sun exposure is like, if he uses sunscreen. Um, and I would also ask about his fingernails, if he's noticed anything with his fingernails that have changed, or if he's had a history of anything with his fingernails. Um, okay, so now we'll move on to inspection. I'm going to inspect his skin. I'm going to start by just doing a general survey and looking at his skin. Sit up for me, buddy. Sit up. Put your hand down. His skin on his face appears to be pink and dry. I'm not seeing any lesions or bruises. I would look at the back of his neck, his back. Everything appears to be pink and dry. Sit up so I can look at your belly and your legs. I'm not noticing any lesions on his stomach or his abdomen. His legs appear to be pink and dry with no lesions. I'm not noticing any varicose veins or any vasculature problems. No redness or swelling anywhere. I'm going to check his temperature of his skin. Let me see your arms, buddy. Okay, so we'll check his temperature. I'll use the backs of my hands and feel his arms. His skin is warm but not hot. His skin also appears to be well maintained with hygiene. It's clean. It's not dirty. I'm going to check his skin turgor elasticity. So to do that, I'm going to pinch right here near the clavicle. I'm going to pinch and pull. It seems to be elastic. It stretches easily. It rebounds right back to where it was. There's no tenting present. It didn't hurt. And I'm also looking for any edema that may be present, particularly in his peripheral extremities. I'm not noticing any edema. There's no swelling. Nothing abnormal in his feet or his hands, his legs. And again, his skin feels dry. There's no excessive moisture. And I'm seeing even distribution of hair on his legs. Very fine villous hair on his arms as well. Okay. Also, the texture of his skin is smooth. It's not dry or rough. Nothing unexpected there. So now I'm going to inspect his hair. His hair color, I would say, is a light brown or, if you will, a dark blonde. It appears to be fine in texture and soft and smooth. Palpating his hair, it doesn't feel to be brittle. And then I'm looking at his scalp as well. I'm not seeing any lesions. The scalp is pink, slightly paler than the rest of his skin, but it is pink. No variations in color anywhere. No lesions. It appears to be evenly distributed around his head for his age.
Is my hair curly, my dad?
Your hair looks good, buddy. And then I'm going to take a look at his fingernails. Okay, let me see your fingernails, bud. Both hands. Okay, so I'm going to look at his fingernails here. They appear to be well maintained. They're clean. They probably could use a trim. They're getting kind of long, but they look smooth. There's no lines or striations on there. Their consistency is they're opaque. They don't appear to be brittle or thin. They look normal thickness for his age. I'm going to test his capillary refill. I'm going to squeeze his fingernail, and I'm going to release it. And I did get a blanch, and color returned within a second or two. So that's an expected finding of less than 3 seconds. The color of his nails generally is like a light pink color, letting me know that there's good perfusion. There's no cyanosis. And the shape of his nails. Let's take your fingers here, buddy. I'm going to take his fingertips. I'm going to put them together. Let your fingers relax. Okay. And I'm not noticing any clubbing. I'm seeing that nice little diamond shape between his fingertips there. So his fingernails look good.
Okay.
So then again, if his guardian was here, or if this was an adult, I would just go over some quick skin assessment techniques that they could do at home. I would explain to them that it's a good idea to occasionally take a look at your skin to see if you notice any new lesions or any moles that you may be concerned about changing in shape or color. Try to be wary of changes in texture of your skin or excessive dryness. If you notice any excessive itching, that's something you could report to your provider. And I would also discuss skin safety ideas. So, if you're going to be working with your hands, or if you're going to be working with your hands, or if you're going to be around anything sharp, just to use caution so you don't cut your skin, because the purpose of your skin is to protect your body and act as a barrier for pathogens. And maybe wear gloves if you're working with sharp objects or working with your hands, and also to wear sunscreen of at least SPF 30, and try to limit sun exposure as much as possible. I know we all like to be out in the sun and enjoy the beach, but excessive sun exposure can be bad for your skin. So I would remind them of those things. But that about does it for me. Do you have any questions for me, Liam?
What is 1 plus 2?
1 plus 2 is 3. Okay. All right. Thank you, Liam.
Are we done, Dad?